So, Dr. Ankit, please be.
Let me tell you, ask the history. Once you come on to the generation, then you
Okay. हाँ जी सर. Good morning, sir. I am Dr. Ankit Chalana, a resident of GMC Patiala Department of Orthopedics, and with your permission, I am going to present a long case of hip. I am presenting a case of Mr. Ravinder Pal, a 52-year-old male, a resident of Patiala, laborer, mechanic by profession, presented to a Department of Orthopedics in OPD with a chief complaint of pain in the left groin region since 2.5 years and limp in the left lower limb since 2 years. My patient is apparently asymptomatic 2.5 years back. Then he started experiencing pain in the left groin region, which was gradual in onset, progressive in nature, dull aching, non-radiating, aggravated on doing activities of daily living, and relieved on taking rest and medication which was prescribed by a local practitioner. The pain was so much so that the patient has to take some rest and after walking a distance of 5 to 10 minutes. There was no history of my patient also complained of limp since 2 years. The limp was gradual in onset and progressive in nature.
So, the history of pain is over. This is a long pain. Is there any relation of this pain to the night or day?
No, sir. No history of.
That means, what is the importance of asking this history?
Sir, to rule out TB, sir, tuberculosis, sir.
What happens in tuberculosis?
Sir, there is a history of night cries.
Why there are night cries?
Sir, because in the night, since the patient muscle relaxes, the patient suffers from pain.
So, if you explore this history, you will come to know something about the disease here only.
Yes.
So, history of relation, diurnal variation of the pain is important. And is there any relation of this pain in walking? Does it really increase? Is there any claudication time or distance?
So, the pain increases as soon as the patient lifts up from the chair and with the first step only, sir.
Okay.
And other thing you see, because the main symptom is pain only. So as Professor Ravi Gupta has told, you should try to explore it in detail. And these things, you should also mention during that pain whether there is any history of some fever before or during. Is there any history of some trauma during that which has precipitated? So those things also, once you take the history of pain, simultaneously you should try to consider or rule out those possible causes which may be responsible for this pain. Okay.
There is no history of trauma. There is no history of morning stiffness and any other joint involvement. There is no.
Secondly, okay, agreed. Here the course. You see that the symptom is important in terms of pattern of onset. What onset is there?
Gradual onset.
It is a gradual. But you see, gradual. What is gradual?
Progress increases over the time slowly.
Over the time, what is the time?
2.5 years.
No, you see, so that is very important. Second thing important is the course of the problem. Gradual is a vague word in such a 2.5 years. I want to know the real course of that problem 2.5 years back once the thing is started till today. So you have to elaborate that pattern. It may have increased first, stabilized, then decreasing. It has gone gradually progressing. Are there some incidents of up and down? It is not possible that in 2.5 years patient has not taken any treatment for that pain and response to those therapies. So it is not means I can't believe that 2.5 patient was in pain and he has not seek for any measures. So what were those things given? How those things have changed the course of the problem? So before jumping to limp, I think you should try to understand this pain, okay, what it may be, how severe it is, what has been done for that, and what is the current status now. So that thing require little more understanding of this. Okay, so I hope you will just let us know about all these things so that we can also know details about the pain. So you can go again and repeat these things.
Yeah, please. Yes.
I'd like to add one thing. A lot has changed after the COVID, this thing. So nowadays there are patients coming up who had COVID. So as a part of COVID or not, we do not know. Or maybe for those who have been treated because of COVID, for COVID rather, with some long-term steroids or something. So people are coming out with problems of hip to that extent. So now I think you should also keep it in mind, and maybe it may be worth mentioning a word about that as well.
Another point is whether the pain was continuous or intermittent. There is some pain-free interval in between.
So the pain was continuous, but it was relieved on taking rest and medications.
Okay. And rest pain, that is very important. Whether patient has pain during the rest, suppose he is taking rest in the evening, that time he has pain, and walking that increases or same pain remains. That is important.
So the
Anything you want to add in pain now, or it is okay? After these questions, do you want to answer those questions? Especially Dr. Vinod and Dr. Kotwal and...
So the patient complained, the patient has COVID immunization in March 2021. After 1 month, the patient started feeling pain in April 2021. And since then, the pain is progressively increasing. And there is no history of trauma and
So that pain is continuously increasing till date.
yes, sir, the pain is increasing.
About any treatment in between, anything?
Yes,
Some remissions or something?
yes,
See,
sir.
what point he wants to make is, he's telling again and again, so what that pain has done to the patient, has that pain affected the daily living of the patient?
Yes, sir, the daily living of the patient has been affected, but he is doing his activity with pain along with some painkillers and analgesics.
Till today?
Yes, sir, he is on analgesics for 2.5 years.
So he is able to manage his professional work,
Yes, but with pain, sir.
and he is on painkillers.
Yes, sir.
So how much painkiller? You see, that again is important. If any patient give history of painkillers, supposedly painkiller, although we don't know, but supposedly, you should know how much he is taking. He is taking SOS once in a week, once in 3 days, once daily, or even thrice daily. So that gives you the severity of pain, because if patient is on pain, what severity you are assessing is not a true severity, because he is already on treatment painkillers. So that amount of consumption of painkillers indirectly give you evidence how severe the pain is. Okay, so have you asked that how much painkiller he is taking?
Yes, sir, he is on SOS basis, sir.
SOS means roughly in week, 2 days, how?
Daily, he is taking daily painkillers daily, sir.
Daily?
Yes, sir.
Around 1 tablet daily.
Yes, sir, around 1.
That is his need.
And if you can know the nature of painkiller also, can you tell me a disease which specifically gets dramatic relief after acetyl salicylic acid? You will get sure shot indication of the diagnosis. You are a third year PG. Anyone from the PGs here? Name of the disease? Osteoid osteoma. Can osteoid osteoma be there in the hip region? तुमने पढ़ा ही होगा यार. What are the common sites of osteoid osteoma?
Sir, in the osteoid side, common side is in the knee region, sir.
Hip में नहीं होता. It's a common site. One of the common sites in the neck region. If there is the osteoid osteoma, there will be pain. But how that pain will be different than the other pain which you are saying, that will be different. Night pain is more, even in osteoarthritis. See, here we are not grilling you. We are teaching them. So don't get confused or embarrassed.
So don't feel tense at all. Relax.
This is not your exam.
The patient also complained of limp in the left lower limb since 2 years. The patient started feeling.
Why you say lower limb? Why not hip region? You said it is not radiated.
Sir, the patient is saying.
But you
in the
initially
left
said
lower
groin.
limb. Yes, sir.
You started chief complaint with groin, now you are saying lower limb.
Yes, sir. The patient was pinpointing over the groin
So
region.
whole of the lower limb. Whole of the?
Pain over the groin region, but limb is saying that I'm having. Oh, sir.
See, what is the purpose of taking history? Can you tell me? What is the purpose of taking history?
To know the course of the disease.
You want to diagnose something, you want to restrict you कि मैं examination local किस part का करना है. अभी पूरे lower limb का मैं करूँगा तो मैं spine की तरफ भी जा रहा हूँ. Right? So मेरे को अगर मैं history में zero down hip region पे कर पाऊँ, which may or may not be possible, but I will try.
And do you know this pain is a point pain, you want to say, it's not radiating at all?
It's not radiating, sir.
At all?
Yes, sir.
Okay.
So where does the hip pain
Do
normally
you know
radiate to?
that...
Dr. Vinod,
yes.
you want to verify from patient also?
Yeah, we will verify.
है ना? हाँ.
First let- we
Sometimes
should
the
see
history
this-
extraction is also not good.
Yeah, because do you know that what is the pattern of radiation in hip pathology, or it is never radiating?
So it radiates, the hip pain, it usually radiates to the level in the knee region, sir.
Radiate
To the knee, sir.
to the knee.
Yes, sir.
Where, on which side of knee?
On the middle aspect of the knee via the obturator nerve.
What is the difference between okay, so like Dr. Aditya is asking, what is the difference between radiating pain and a referred pain? There are two different concepts. One is a radiating pain, the other is a referred pain.
What you are telling is the referred pain. That hip pain refers to knee. It's because of the hip, but patient is complaining in the knee.
So for the so if somebody can tell from the PG other students, what is the difference between a radiating pain and a referred pain? Dr. Aditya had asked a
He
question.
is there, yes.
Good morning, everyone. In case of the referred pain, we are having pain at the side, and also it is going to the distal side also. However, in case of radiating, in case of radiating, sir, pain is complaining at the side and also go to the other side. While the referred pain, we are not